what I always say to people as a general practitioner, yes, we spend our days treating patients, but we spend a huge portion of our time actually sharing knowledge and information on health issues for each individual, for whatever the problem might be, so that it enables people to feel comfortable with that information to make the decisions that we do jointly for better health. So this whole vaccine program and this response to this pandemic is all part of a big process that we are all working together with the medical fraternity, but obviously each individual person and society to try and find the best solutions for solving the pandemic problem. So as I said, it's our daily task, and I hope that with today I'll be able to, and with this opportunity, I'll be able to give you some answers to your questions and also provide you with information that will make you feel more comfortable with the decisions that you need to make for better health and for our better health for our society. So I thought we're 18 months in South Africa, 18 months nearly into this pandemic where it's affecting our lives and having a profound impact on how we do things. And what we've learned a lot about is this virus. And if we think back 18 months when we were being told about COVID virus and what we know now about COVID virus, we're actually feeling a whole lot more comfortable about how to manage it. So as doctors, we have at least got a plan for people when they get sick, what they need to do, what they need to take. And we also have a plan that we actually know when to implement treatment and start people on medication much better than we did some 18 months ago. So as far as the COVID disease is concerned, we've made a huge amount of progress, and the learning curve has been exponential. It's been a sharp learning curve, but at least we feel more comfortable and we can do things about it. Unfortunately, we've also learned some realities about the virus is that we still have an enormous number of deaths, more than what we would normally have had. In the past year, South Africa alone, the South African Medical Research Council is recording over 206,000 additional deaths. So we've lost 206,000 people more than what we would normally have done in the years previously. So, you know, it's a significant pandemic. So that is the COVID side. Then, because we're talking about vaccines as just a basic introduction, one of the threads in the questions that comes through is people say this vaccine is questionably experimental. It's been produced so quickly. Can we trust it? And I think that we all know about vaccinology. We were all given polio vaccines as babies and measles, mumps and rubella vaccines as babies. And we've all managed to pull through, and I think you will all agree with me that we don't know of anybody who's had polio anymore. Polio has been eradicated because of vaccinology. And I mentioned polio because polio is also a RNA virus like the COVID virus. And the vaccines that we use for polio, we use similarly for COVID. The mRNA vaccine is in fact the Pfizer vaccine. So what we're using decades of knowledge from previous vaccines that we've produced and used successfully to formulate our modern day COVID vaccine. In fact, a lot of the work that has been used for our COVID vaccines has come out of the research that was used for the Ebola vaccine. So now that I've mentioned those two aspects, how was it possible that we got this vaccine so soon? They've been working on those vaccines for many years. The difference is that vaccines historically were researched by scientists working at universities, and they rely on university money and donor money in order to fund that research. when COVID came along, the United States alone put millions of dollars into researching the vaccine because the governments realized the only way to manage this pandemic is to find a vaccine. So huge sums of money have been dedicated to research, huge numbers of resources. Many scientists throughout the world have been working on this. And then we had the historical information from our previous vaccines, and putting this all together, we've been able to formulate a vaccine. Also, I read an article where they said traditionally it would take them 3 years to recruit enough volunteers to test a vaccine. Now, with the COVID vaccine, they had thousands of people coming forward and saying they were happy to be guinea pigs to test the vaccine. So I want to be able to tell, and I can tell you already, that if you go tomorrow and have a Pfizer vaccine, you can be reassured there are millions of people that have already taken that vaccine. We know already in the United Kingdom, in England, they've vaccinated over 40 million people. In South Africa, the J&J vaccine, 500,000 healthcare workers, myself included, we signed on to take the J&J vaccine, and that was when it was still in the stage 3 trial period. It has now completed the trial period and is now fully fledged, registered and recognized treatment. So with that in the background, I'm going to now tackle your questions, and hopefully you'll feel that the answers are addressing your questions. So the first question that I got was, can the vaccine safely be given to someone with protein deficiency? And what I'm going to do is I'm going to take that question and I'm actually going to make it broader based and say, change the question around and say, who cannot take the vaccine? It's much easier to go that way. And in fact, at the moment, basically, we are giving the vaccine to everybody across the board. All age groups, adult age groups, and they're even starting with children, but in fact, adults. And the only time that we don't give it is if someone is actually ill. If you've got flu type symptoms, you're not feeling well, or you've got a current infection, we would delay the vaccine until you're feeling better, and then you get the vaccine thereafter. But essentially, whether you've got cancer and you're on cancer treatment, whether you've got an autoimmune condition where you're on drugs and medication that might suppress your immune response, you still get the vaccine. If you've got HIV and you're on treatment, or even HIV without treatment, we are giving the vaccine. We are even giving pregnant girls the vaccine. We do, however, give the vaccine to the girls only after 20 weeks of pregnancy. We want to be sure the baby's completely formed and that she's just in that part of the pregnancy where the baby's growing. So the pregnant girls are also getting their vaccines. So essentially, yes, everybody should, from a health point of view, take the vaccine. The one thing that we say is that if one is maybe on chemotherapy or you have got immune suppression, that your response to the vaccine might not be as strong. So the vaccine might not be as effective as it would be in someone who's not on immunosuppressive therapy, but it will still lend you a significant advantage. So then the next question was the question about blood clotting and the COVID's relationship to blood clotting, because that's what you've read in the newspapers. And essentially, after those issues got raised, they really started looking closely at the numbers. And in fact, they say your chance of getting a blood clot from having a COVID vaccine is 4 in a million. I counterbalance that comment with, if you catch COVID, a large portion of people who have COVID develop blood clots, to the point that in fact, they're talking about 16.5% of people who have COVID will actually get a blood clot. So COVID itself causes what we call a coagulopathy. It causes blood clotting problems. So to catch COVID is far more dangerous from a blood clot point of view than to take a vaccine from a blood clot point of view. So I always say to my patients, when we're talking about medicine and illness, we need to balance the two against each other. And if some people feel really bad about taking the vaccine, I always say to people is, if you don't like the vaccine, you also don't like the disease. And which one are you more fearful of? And over here, clearly, if you look at those numbers, 4 in a million or 16 and a half in 100, the maths just tells you your betting is far better to go with the vaccine. Okay, so as far as the blood clotting issue is, we definitely say, please don't worry about it. If you are on blood thinners, absolutely. As I mentioned to you, COVID causes blood clots. So you're actually, in a way, you're actually protected by being on the blood thinner. You're better off than someone who's not on the blood thinner. So those people that are already taking blood thinners, you continue with them and don't worry about being on the vaccine because you're actually at an advantage there. The only thing is that if you're on warfarin, you just got to check that your blood's not too thin, because it can be associated with bleeding if your blood is too thin. So just check your blood clotting level, your INR, before you go for the vaccine. Then the next question. Once we take the vaccine, do we still need to wear masks? So the answer to that is yes, because when we wear a mask, we are not only protecting ourselves, but we're actually protecting others. So in fact, me wearing a mask actually protects you from catching the virus from me. So at the moment, while most of our population does not have the vaccine, we have to continue to protect each other. And although you might not be at as great a risk of contracting COVID after having had the vaccine, you can still get it. And we need to keep everybody in masks, because it gets impossible to otherwise differentiate whether you should or shouldn't be happening. And I think we need to just work at this together and team up together and look after each other. Wearing a mask is part of that. And accepting, people sometimes still feel very self-conscious about wearing a mask. But if I wear a mask, it makes them feel comfortable to put that mask on. So, and yes, I'll address the risk of getting COVID at this point after you've had the vaccine. The COVID vaccine, if you've had the J&J vaccine, they say that your protection is in the region of 60% from catching COVID. So it means that you still have a chance, 40% chance of catching COVID. If you have the Pfizer vaccine, the protection seems to be much greater, in the region of 95% protection, but there's still a 5% chance that you can catch COVID. So the vaccine works to protect us from catching the virus, but not 100%. I think I always draw the parallel for people that when you have the flu vaccine, most people that are familiar with having your annual flu vaccine, you know that you can still sometimes catch flu despite having had the vaccine. But what happens with the vaccines is that the vaccine helps your body fight the virus. So if you are unlucky to catch COVID after having had the vaccine, you will not get as sick. So it prevents you from getting severely ill. So they've already shown dramatically in England that if you see the number of people that are needing hospital and are dying from COVID, the numbers have dropped. They've literally plummeted. And I'm going to illustrate the figures from just a little more than a week ago. In South Africa, we were reporting in the region of 22,000 new COVID cases per day. In England, they were reporting 32,000 new cases per day, so very many more than us. But they were reporting 4 or 5 deaths per day, and we were reporting on the one day 600 deaths, another day 390 deaths, another day 210 deaths. So the number of deaths in South Africa is significantly higher than the number of deaths in England, yet England are reporting more COVID cases. The difference between South Africa and England is England's population has been vaccinated and ours hasn't. So England have vaccinated more than 40 million people and they've got 60 million. We've got 60 million and only 5% of our population are vaccinated. So if you look at those numbers, the numbers tell you a big story that the vaccine helps keep you out of hospital and helps preventing you dying from COVID. It's never 100% guaranteed. There are still people, but the vast majority will be protected. So that is the huge advantage of the vaccine. So then we'll move on to another question about the vaccines, and that was, if you've had the first dose vaccine and you are due for another vaccine dose, but you get COVID in the meantime, what do you do? Basically, all we do is you just delay the second dose to 28 days after you started getting sick. So it might mean that your second dose will be delayed. This immediately raises the question, why did you get COVID if you've just had the vaccine? Unfortunately, we believe that you probably were already getting sick or you'd already been in contact with someone with COVID at the time that you were being vaccinated. Please, the vaccine does not make you get COVID. You caught it somewhere in the shopping mall, wherever you were going, that is where you got the COVID. It's not the vaccine that caused it. But unfortunately, the timing was just bad, that you just didn't have the vaccine early enough. And remember that when you get your first dose vaccine, it takes 2 weeks for the vaccine to start working. So you only start to gain that benefit of the vaccine 2 weeks later. We also know that with the Pfizer vaccine, that the first dose only protects you about 30%. The second dose protects you 95%. So when you've had that first dose, you're still not yet protected until after you've had the second dose. So as you know, the doses are 42 days apart. This process of vaccinating takes weeks, a couple of weeks, to get you vaccinated. So that is also yet another reason why when you've had your first dose vaccine, please, you need to continue to wear your mask, social distance, and sanitize. Another question people have asked is if they've had the one Pfizer dose, are they sure to get the second Pfizer dose? What happens if they run out of doses? Will they just give another vaccine? Don't worry, they are monitoring closely who has been given the vaccine and who is due for a second dose. Currently, there is ample vaccine in South Africa to provide people with both doses. And you will, if you've had the first dose, they will make sure that the second dose is available. Whether you can mix these vaccines, the answer is actually, it looks like the answer will be yes. And in fact, we believe that in future, once everybody has had the opportunity to get their vaccine, that those who are interested in having a second or different vaccine will be welcome to do that. I certainly personally think that once everybody's had their vaccines, I've had the J&J vaccine, I will certainly consider next year when everybody's been vaccinated doing the Pfizer vaccine. Why? The reason is our body protects against infection by various defense mechanisms, not just one defense mechanism. And what happens is the different vaccines and even COVID itself stimulates those different defense mechanisms. So the more variants of vaccine you get and the more times you get infected, the more broader your immune system is capable of using different defense mechanisms to protect you. Okay, so I do think it's much like the flu vaccine in a way. We tell everybody every year to have a flu jab. And the reason is that it broadens your protection and protection base. And it makes sure that if you've had a flu vaccine, that you better deal with the flu so that you don't land up getting pneumonia and dying from pneumonia. Okay. I do believe that another way that I explain it to people is that we all have had children. Well, maybe not all of us. I think a good portion of you out there in the workforce might have a family and children, and you'll know the stories of little kids being sick every month when they're going to creche. And here these kids have not been exposed to the flu virus. And every time they go back to school, they land up getting sick. And these moms come to me with their children, and eventually after 2-3 years, they despair. They say, my child is sick all the time. And I say to them, don't worry, when your child turns 4 or 5, they would have been exposed to enough flu that they will be much better, and I won't see you again. And it happens every time again. Once the children are older, they don't get sick so much anymore. So the same is going to happen with COVID. We will catch COVID, but our bodies will get more sensible and more wise to the virus, and then we will be able to cope with it, and we won't get so sick anymore. This is a brand new virus for the humans, and that's why it's a pandemic. Our bodies don't know it. It hasn't been exposed to it before. So we're like a child going to creche for the first time and not knowing about the flu virus in the past. We're now into the world, and we get on an aeroplane and we get exposed to COVID, and our bodies have never come across the virus before. That's why we're dealing with the pandemic. So I hope that gives you an idea of some of the questions where people are saying, if I take the vaccine, I hear I can still get COVID, why must I bother? I hope I've answered that. And the second thing is answering the question where people say, if they've had the vaccine and they still catch COVID, is that possible? And as I said, it's actually at an advantage. Then the more exposure our body gets to this through the form of a vaccine, the better we'll be off in the long run. So I hope that actually covered a whole lot of the different questions that came through in different wordings. I wanted to then move on to another question that was raised, and it was regarding the issue of taking other medication, and particularly the ivermectin. One of your staff asked about the fact that she's been taking ivermectin and now she wants to go with the vaccine. Is it necessary to now do the vaccine, or does she continue with ivermectin, or what do we do? Ivermectin is a drug that we used to use to treat a skin condition called scabies, little parasites. And so it's a very old drug, but it was withdrawn from the market because of fears around side effects. So it, for many years, has not been available for use in humans in South Africa. So when the public started hearing about ivermectin on Facebook and YouTube and that towards the end of last year, throughout the world, there were a number of sites where they started really looking very closely at whether ivermectin does or doesn't help. And this Professor Moore, who told us about we practice evidence-based medicine at the beginning of this year, was saying to us, doctors do not prescribe it, the evidence is not there. People have used ivermectin, but they've used it anecdotally, or they've used it while they're taking cortisone or antibiotics or other things as well. So you didn't really know for sure whether it was the ivermectin that was helping or not. So they said we had to wait until the trials have come through that have specifically looked at ivermectin. And in fact, in the last 3-4 weeks, we've started to see the results of those studies coming through. So that's taken 6 months, that process, to work through those specific trials on ivermectin. And the data coming through now is showing that ivermectin does not work. It does not have an impact. It doesn't work for prevention, and it doesn't work for treatment. So the trials are proving what we needed to hear. It's sad, it's disappointing, because it might have been a wonder drug, but now we've got the real information, and we again work on evidence and the evidence says no. So to answer that person's questions about ivermectin, I would strongly recommend you just stop the ivermectin and rather vaccinate. And the side effects of ivermectin, I do tell my patients, I actually had a look. You can get ivermectin at the agri and the veterinary surgeons, they give it to animals. And I looked at the little bottle of ivermectin and the insert, and it read that you may not slaughter a cow within 120 days of giving it ivermectin, and you may not slaughter a sheep within 70 days of giving ivermectin. That must tell you a story about ivermectin. They clearly don't want you to eat meat from a cow or a sheep when it's been given ivermectin. So we worry about the potential neurological side effects. So I would strongly discourage you from using it. Next question, okay, is about a gentleman who struggles with pneumonia, and he knows obviously about the flu jab because he obviously uses that to prevent pneumonias and his chest infections, and is a bit concerned about the ingredients of the vaccine containing alcohol because his religion doesn't permit it. Don't worry, there is no alcohol in the vaccine, so you don't have to worry about that. But I think in the light of his question about his susceptibility with his pneumonia, it brings me to the discussion around the comorbidities. So comorbidities means you've got other health issues. And I'm so often hearing people saying, I've got heart disease, high blood pressure, or diabetes, so I'm scared of taking the vaccine, that it might do me more harm. In fact, everything is pointing the opposite side. If you have diabetes, heart disease, high blood pressure, tendency to chest infections, and you are overweight, those comorbidities are showing to be at your disadvantage for the disease. So COVID affects those people very much worse. And the vaccine is going to protect you. So you are the ones that should be standing in the front of the queue, because if you contract COVID, you have a much greater risk of running into trouble because of your pre-existing health problems. So, and in fact, Ryan Noach, the CEO of Discovery Health, now they're obviously looking at what COVID is doing to all their members because they need to look after these people on the medical aid, and they're going to be watching them in years to come. And he showed in his presentation a graph which showed people that had COVID once and how much health care they need after they've had the COVID. And they can already see the demand on their healthcare is greater than someone who's not had COVID. And then he showed the graph where they've had some people that have caught COVID twice, and their graph runs much higher. They're still going to the doctor because they're having ongoing problems from having had the COVID. So COVID causes long-term problems that we need to be very, very mindful of. So people in one breath asking, one of the questions here is, are there long-term side effects of the vaccine? COVID has got long-term side effects. They've already shown that if you have had COVID, you have a 2.5 times greater risk of becoming a diabetic. You probably wouldn't become a diabetic, but it brings out the diabetes in you. You also have a 1.5 times greater chance of having cardiovascular disease. So it's already showing that COVID unmasks and brings out other conditions. So another argument for trying to get people to vaccinate. So there's a big call from Ryan Noach, Dr. Noach, to say, please guys, we need to encourage people to vaccinate, because if we can prevent them getting COVID in the first place and minimize their disease, we will minimize the post-COVID illnesses. So I hope that that's explained that concept as well, because definitely people are scared of the vaccine because they've got health issues. And in fact, it should be the other way around. You should be running to get that vaccine. Okay. And then what are the side effects so far of the vaccine that we've seen? And really, the vaccine seems to be exceptionally well tolerated. You very often hear people that have had the vaccine, they say they haven't felt any different the next day. Personally, I had the vaccine, and I do admit that for a day, I did feel a bit fluey. I took some Panado for a headache and felt quite achy, but then it passes. So it's really those sort of mild flu-y type symptoms, and usually within a day or two that passes. Another question someone raised is, if I had no symptoms on the first jab, will the second jab give me symptoms? In fact, the majority of people, again, no, but some do find that they get more symptoms on the second jab. And I always say to people, the reason for that is that your immune system is certainly familiar with the virus from the first jab, so your reaction is maybe a little bit more pronounced. So there is a chance on the second jab you might feel a little bit more headachy, a little bit more achy, and certainly you get a bit of a stiff sore shoulder where the jab was given. That certainly is a common little thing where it's a bit stiff and sore. So those are really the side effects. Ryan notes, obviously, because they've got their discovery data, he said they had one person who had an allergic reaction to the vaccine and had to be hospitalized overnight and then went home the next day because of an allergy reaction. But that is the one and only I've heard of, but you know, they always talk about it, that obviously you don't know beforehand whether someone might be allergic or not. I hope that that reassures you as well, as far as that is concerned. And then the last thing that I just sort of want to do and say is that the good news is that the majority of people who get COVID actually do very well. And you've probably all come across it where you know someone who tested positive and they didn't have a single symptom, or they had a little scratchy throat and 2-3 days later they were better. And this applies to 80% of people. So thank goodness the vast majority of us are going to get through it without a problem. But it's those others that don't. And we need to work together to try and help protect those ones that are going to get potentially very sick with COVID. And those are the ones that we're really, really focusing on. And the only way to help them is to work together and all participate in this wearing of masks, social distancing, sanitizing, and vaccinating. So I hope I've covered most of those questions. I think I've actually ticked all of them off. There was one last question that someone was really concerned about, the fact that the virus, he had obviously read articles about the virus being very dangerous and causing many deaths, and why has it not been withdrawn from the market? And my only answer to that would be, please folks, when you read things on social media or you hear people talking in discussion, please just think who's telling you this, who's published it. There's lots of false media out there. I don't know why people sometimes have to say things when they don't substantiate it with evidence. I mean, there's no proof of these deaths as a result of the vaccine. I mean, that's why we're still rolling it out. So please be careful and just think twice. If someone posts something on social media, just have a look and see who that person is and from whence it comes. As a doctor, I rely on my colleagues. We have WhatsApp groups. We share information together all the time because we're trying to make sure we stay on the forefront of the information, because you are the ones that are asking us the questions. So we spend a lot of time focusing on what the information is and where the information comes from. So we rely on reliable sources. And we look at our academics. We've got wonderful academics in this country. A very good friend of mine is a professor of infectious diseases in Johannesburg, Professor Ian Zanna, and Professor Mervyn Moore. They spend a lot of time in that academic environment looking at the evidence, and we get guided by them as well. So we feel comfortable with our source of information because we need to be able to feel comfortable in advising you on what's right and what's the way to go. So Bridget, I've been rattling on, and I hope that it wasn't too quick and that people have been able to keep up, but there's a bit of time now for people to pose questions. I think you might have picked up some, so maybe I can help answer some of those.
Good. In fact, it's been so interesting, and I've been getting lots of feedback that people are really enjoying and finding a lot of benefit in what you've been telling them, Theo. You've answered so many of the questions. So I had about 8, but as we've gone along, I've deleted most of them. But I do have 3 that have come through, and perhaps everyone could send more if you'd like more. One is, why must we wait 42 days in South Africa between vaccines, but it seems to be less in other countries?
Okay, so the timing is really based on resources. So the Department of Health obviously needs to have their vaccine sites adequately sourced and provided with enough vaccine so that they can dispense to people, and also from a timing point of view for people to be able to get back to the facilities. So they did push out the time frame so that they could try and get as many people the first dose. Because remember, the first dose keeps people from getting severely ill and keeps them out of hospital. The second dose boosts your response to protecting you from catching the virus. So for the health services, the most important thing is to keep people out of hospital and keep people from getting severely ill. So that's priority. So you want as many people to have the first dose as quickly as possible. And then the second dose comes to top that up. So that was really mostly the reason. We'd rather have more people with one dose and then follow on, then have a small group of people with both doses and the others waiting out in the cold. So that's really the theory. So as soon as we have our bigger base covered, that time interval will most likely be reduced to probably 28 days.
Okay, thank you. Then news that the Pfizer vaccine will soon be created and put together in the Cape in South Africa. How do we know it will be of the same quality as it is the vaccine that arrives from international shores?
Okay, so the way I understand it at the moment is the facilities in South Africa that will be putting the vaccine together for us, they use the actual ingredients actually comes from the United States, from the factory in the United States. And it is really just putting it into the vials and into the bottles and the distribution that is going to be done in South Africa. So that process in the production line is actually what's going to be done locally. The actual vaccine is still coming from the laboratories and the factories in the United States. In fact, that was one of the reasons why there was a little delay early in the vaccination process with getting our vaccines. There was some concern about the production of the vaccine in the United States, and they had to recheck the conditions at the factory, and that put a hold on the distribution. So that held up the process of deliveries. But now they will supply the actual vaccine, the actual muti, in South Africa, and we will just put it into vials and distribute from there.
Okay. And then the question of anaphylactic reaction came up, which you have addressed. You did say that there were very few cases of it, but if someone had that reaction first time, would they carry on and have the second dose, or would they be advised not to?
They would be advised not to take the second dose. Yeah, if you have a reaction that is severe, and that is why we do ask people to please notify us if you have a reaction. And remember that reaction would happen within a short time frame. So people would have already noticed, those that have been for vaccination, that they are asked to remain at the facility for 10 to 15 minutes before they're allowed to go home. So that 10 to 15 minute time frame, if you're going to have a problem, it'll usually be within that time frame. I had someone the other day that said, came in with a problem, and she said, I had the vaccine, and then I've been starting to feel like I had a bunch of symptoms. But I said, when did those symptoms start? No, about 5 days after I had the vaccine. I said, it's got nothing to do with the vaccine. It's a separate problem. So I think that often people worry now they've had the vaccine, and as soon as they feel anything else, they immediately think it's the vaccine. Just remember, folks, that at the moment, there's lots of flu bugs around. We've been seeing tummy bugs around. So the normal things that we've always had historically are still around. The normal illnesses and sicknesses are still there. COVID is just over and above that. Bridget, I do remember one other question, and it's a bit more tricky question, and I think the lady's got a very, very valid point. It was, she said, the traditional healers were not consulted over the vaccine, and what do I do? And I think that in our multicultural society, a lot of our community seek healthcare professionals from different sectors. And our traditional healers obviously play an enormous role within our communities for people, and they trust these practitioners like my patients trust me. COVID has come along in such a short time frame, and the world has clubbed together to investigate and find and tackle and find solutions and potential solutions for this problem. And in these smaller groups, the traditional healers that are localized and regional, they will be incorporated over time in the information and what's going on. And I think it's very difficult to dissipate that information from the top. So I would certainly hope that healthcare practitioners that work in other sectors are spending time researching and reading about what we're doing in the sort of modern medicine terms. So I'm sure that the traditional healers will come on board like they have, I mean, with other treatments. I know you mentioned to everybody that I worked in the HIV environment for a number of years with Right to Care. And we also had to work with the traditional healers there to get them to help us recruit people to come and get onto ARV treatment, you know, and that really we know that antiretroviral treatment is the only thing that really keeps our HIV positive patients fit, healthy, and living a healthy life. And the traditional healers have come on board and they are doing that. And it has been a process. Unfortunately, it takes time. I know in the HIV thing, we were 10 years into it, and we're still busy trying to get people comfortable with it. We've only had 1 year, so it's going to take a bit of time. And I just hope that the traditional healers will allow people the opportunity to listen to what we're saying, that people will feel comfortable. And I hope this particular individual who posed the question is comfortable with what I've been saying today, and will go out there and tell her friends.
Thank you. A couple of other questions that have come through. How long does the vaccine last? Will we need to have a new vaccine every year?
Yeah, very good question. So, in fact, we've been tracking the immunity story with COVID, And the COVID infection itself, people get antibodies after they've had the infection. And we've then looked at measuring those antibodies, because that is something that we are able to measure. And we've actually noticed that after 4 months, most people no longer have antibodies. So it is clear that antibodies is not the only way people protect themselves against infection, but it also shows that there are changes that go on with the virus that enable it to still affect us. And that's why we're seeing people getting COVID a second time, and even a third time. I know of someone who's had it now for the third time. So if you get COVID itself, it certainly doesn't guarantee you from not getting COVID again, but your risk of getting COVID again is only about 30%. Okay, so the feeling is that by having had COVID, you will be protected to the level of about 70% protection and 30% chance of catching it a second time. And certainly if you catch it a second time, that 30% will reduce even further.
Okay,
the vaccine,
good.
At the moment, the vaccine, and just knowing how the vaccine works, the Pfizer vaccine, they are saying that things are looking very positive, that will give you long-lasting immunity, that the immunity on that Pfizer vaccine will be hopefully indefinite. What it does, however, what needs to be raised is that you would have already heard about various variants. We have the Alpha, the Beta, the Delta variant that we're dealing with now. They're talking about a Lambda variant. Unfortunately, they labeled these variants with countries, and unfortunately, South Africa got labeled with the Beta variant, and unfortunately, we're, as a result, categorized as a red country for COVID, which is totally unfair, and our health authorities need to argue this because the variants are all over the world, and in every country there's going to be a variant. And what we don't really know is that whether the variants will be covered by our current vaccines in the future. So already we know the Delta variant does respond to the Pfizer vaccine. We do not know about the J&J vaccine, whether the J&J vaccine has any protection against Delta. We do know it has got very good protection against Beta and Alpha. So another way just to, so what I'm really saying there is that much like with the flu virus also changes a little bit every year. And that's why you need a new flu vaccine every year. That probably with COVID, because the COVID virus changes slightly every year or every time, we probably will need a booster vaccine every year for COVID. So you'll be vaccinated this year. Maybe next year, the variant that will be prevalent will be Lambda or Omega or whichever, and they will formulate a vaccine that will be specific for that variant, like we do with the flu jab every year. So I do think you'll have a flu jab and a COVID jab every year.
Good. So you've answered quite a few of the questions that have come through. There's another one here. I think you may really have answered it, but let's just pose it. If you're planning on a pregnancy in the future, does that impact whether you should take the vaccine or not?
So I think that if you're planning in the future to have the vaccine, to have a child, the principles behind vaccinating for your personal health absolutely apply. So we would encourage that. If you are not sure whether you are pregnant and you might have fallen pregnant now, or you're currently in the process of trying to fall pregnant, then we would say we would be cautious of vaccine because we don't know what happens in the early pregnancy. So in that instance, you need to speak to your doctor and have a look at when you're going to time your vaccine. So remember that it takes about well, 6 weeks for the vaccine to be effective, because you have to do the 2 doses. So you're looking at almost a month to 2 months before you fully vaccinated and fully sorted. So I think that one would look at rather delaying on the pregnancy if you're planning it per se. Okay.
Okay. Good, thank you. The next one, Theo, is the anaphylactic reaction. Is this something that people who are allergic to bee stings be worried about? No,
so if you've got any pre-existing allergies, there's no ingredients in the vaccine that overlap with that. I think that sort of question stems from the fact that historically, people were always asked, for example, with the flu vaccine, that if you had an egg allergy, you shouldn't get the vaccine because the vaccines were actually cultured and grown from egg protein. So there was a link with eggs. So we wouldn't give people the flu jab if they'd had eggs. So people have heard of stuff that could possibly overlap. There's nothing in the vaccine that will overlap, or in the formulation of the vaccine that will overlap with anything that you might be previously allergic to.
Okay, thank you. Then this one, if you have had the vaccine and thereafter get tested for COVID, will the result be positive because of the vaccine itself? And if so, how long after having the vaccine will you get a positive COVID result?
Okay, so the COVID test that we do, the gold standard COVID test, is a nasal swab, and sometimes they do the swab in the mouth. And that swab, what it does is it detects the virus. It detects the RNA, the genetic material of the virus. And so if you've had the vaccine, you don't have the virus, you've had the vaccine. So the swab will always be negative. So when you've had the vaccine, you will always have a negative test unless you actually catch COVID. So if you've had the vaccine and later on, months or so down the line, and you have a COVID test and it tests positive, then unfortunately you're one of those unlucky ones that fall in that 5% group that has gone and caught COVID despite being vaccinated. Okay. The only test we can do to know that the vaccine is on board is we can do an antibody test. But the antibody test is a little blood test, and you have to specifically state to the laboratory that you're looking for post-vaccination antibodies, because they're very specific antibodies. They're in fact different antibodies to the antibodies that are produced by the COVID disease. So if you've heard of someone who's been for an antibody test, they need to have been sure that they were testing for antibodies after they got the disease, or they were testing for antibodies after they got the vaccine. So there is a test that can check that, but there's no point in doing the test. It's just academic, really, at the end of the day.
Yeah. Good. So I can see we've only got 1 minute left. I think you've answered all of our questions.
I've got one more to add, Bridge, seeing as we're running out of time, and that is a little comment that we have all known that if you travel up into Africa, you need to have a yellow fever vaccine. Otherwise, the countries won't let you in. I'm afraid that I think that we are going to be faced with the fact that if you want to get in an aeroplane and travel anywhere in the world, you are going to have to prove you've been vaccinated. And a vaccine card is going to be essential. So I think that is also going to encourage people. Well, a lot of people will realize that travel is going to mean you have to be vaccinated. And already in England, you can see people are going back to normal life. They are going to watch Wimbledon tennis. They're going to watch the football. They're watching Grand Prix, but when they go to those events, they've had to produce their vaccination card. So if you get your vaccines done, we will be able to prove we're protected, and we will be able to open up the world, open up the economies, and people will be able to go back to a normal life where you can go and watch the football, you can go and watch the rugby, you can do things like we used to do. And but the vaccine card is going to be something that will be called upon.
Absolutely. Yeah, we're all looking forward to getting life back to normal and being able to have that freedom.
That's the goal. Is the vaccine is going to be our passport to opening up the world to what it used to be, as close to what it used to be as it can. It'll be different, but it'll be very much like it was. I mean, in 100 years ago, the Spanish flu locked people away for 3 years, and they were behind masks. They were social distancing, isolated, but after 3 years, they went back to normal life. So I'm confident that we, in a couple of years, we will be back to a normal life, walking around without a mask and interacting with our friends and socially getting back together. But we just need to get through this phase, and the vaccines is certainly going to get us there much quicker than if we don't vaccinate. And England is leading the way in this. They've vaccinated within 18 months. They're already going to watch the soccer. We can't do that. Okay, we still locked down. If we want to get rid of lockdown, we need to vaccinate and get people out there after that.
Great. Good. Theo, I've had lots of messages saying thank you. They found this to be the most valuable session. So thank you for your time and for all the consideration that you've put into preparing for today. Really appreciate it.
Great. It was my great pleasure, and I really hope that all of you will go out there and spread the word, that it does also go beyond our discussion, and that you take it to your family and friends. And I wish you all well. Keep safe.